Hello, my name is Eva Vasquez. According to the Centers for Disease and Control and Prevention, or CDC, an estimated 27% of U.S. women ages 14 to 59, or 24.9 million women, are infected with HPV. Some women develop cervical cancer because they did not seek regular screenings. Today, I would like to talk to you about women with disadvantages and pap smear screenings. I will explain the benefits of receiving regular screenings. I will follow with the negative association regarding pap smears. And I will finalize by briefly offering a way we can help women with disadvantages seek pap smear screenings. First, I will begin by explaining the benefits of regular pap smear screenings in a sexually active female. According to Ferley Matters and Packin from the Internal Journal on Cancer of 2010, 1.5 million to 2.5 million women can be saved in developing countries, such as Rwanda, by seeking vaccination against cervical cancer caused by HPV virus or human papillomavirus. The benefits support the evidence. According to the same source, in 2010, 986 cases of cervical cancer were diagnosed and 678 women died from the disease. That's a significant number. Cervical cancer is prevalent in the female reproductive system. A pap test is an effective method of prevention and discovery. Cervical cancer is the fifth leading cause of cancer-related deaths among women younger than 50. Thus, women should seek preventive checkups. This was taken from the Perspectives on Sexual Reproductive Journal from 2010. Another source used was the Harvard Women's Health of 2011. In it states a recommendation for women to seek screenings every 1 to 3 years, up to age 65. Women 65 and older may not need regular screenings if they have experienced normal screenings and are not at high risk for cervical cancer due to HIV or AIDS. Now let me explain the negative association. I have explained what pap tests are. Now let me share the reasons why socially we should care women receive regular screenings. Women with disadvantages are less prone to seek routine checkups due to environmental and financial reasons. These women may not seek routine female checkups due to social stigma. As mentioned in the Mother's Daughters HPV article I researched, mothers with infectious diseases may be prone to seek screenings for themselves and their daughters. However, HPV is related to sexually transmitted diseases, thus deterring other women, as they may feel they may be negatively associated with them. Another factor is the financial hardships. Women in this position may or may not have a job or medical insurance to seek checkups. Another factor we'd like to mention is knowledge on the subject and available resources in their communities. Women with disadvantages may feel it is more important to feed their families and keep a roof over their heads rather than seek medical attention. According to the Disability Pap Smear Receipts Journal, out of 31% of women that had disadvantages, 13% of those mentioned financial and medical insurance were important factors. Socially, it's relevant to all of us because these women could be our grandmothers, mothers, daughters, our friends in these situations. Women who may need a helping hand in the form of a health fair that they can easily access without any financial strings. Now on to my point 3. Helping women with disadvantages. The CAP Foundation is sponsored by the College of American Pathologists and funds a humanitarian program called See, Test, and Treat. The program was created by the college and has helped several hundred women since inception in 2011. The program is mobile, equipped with physicians, pathologists, and other medical staff who volunteer their time for this noble cause. Women from underserved communities are screened for breast cancer and cervical cancer. The exams provided are mammograms and pelvic exam, which include a Pap test and a diagnosis, follow-up, and care. And also education counseling is provided the very same day. For many of these women, the program is a life-saving event. Some of them have never received screenings before or had a follow-up from a diagnosis. We all have one thing in common: the basic need to help one another. The program See, Test, and Treat is supported by college members, staff, and by people like you and me. Let me conclude by saying we have established Pap smears are routine checkups that all women should have access to. Sometimes due to economic and financial needs, women with disadvantages are less likely to seek screenings. We have also tapped into the social awareness and the benefits of helping others. With all this said, I would like to leave you with a thought to support this program or programs like it that help underprivileged women in our nation to have basic routine checkups. Basic for some, but a luxury for many. Please visit the CAP.org website and visit their foundation page to learn how to help someone in need.